Voice of Armenians TV New York recently had an opportunity to visit the office of our compatriot Dr. Alina Kochoumian Stanciu and learn about her work in eye care as well as cosmetic and aesthetic improvements, including Botox, Juvederm, Radiesse, Restylane, Latisse, and wrinkle reduction. Dr. Stanciu is a board-certified ophthalmologist with over 18 years' experience in specialized medical and surgical eye care. Dr. Stanciu is both widely recognized and highly regarded for her ability to provide expert medical and surgical care, combining advanced medical specialization with warmth and sincere human empathy. In the first part of this two-part segment, Dr. Stanciu will focus a technique she has personally developed called European Fluid Facelift.
I want to welcome you into my office and my practice and talk to you about the European Fluid Facelift. What is the European Fluid Facelift? The European Fluid Facelift is a procedure I developed as an alternative to traditional surgery because over the years I found more and more women and men that they want to have a procedure that they could look younger and natural without using surgery. This procedure, it's a quick procedure compared to surgical approach. The results are immediate, relatively painless or very little pain, is very little bruising. People could go on with their activities after this procedure with very few limitations. I advise my patients to avoid going to a dentist for about 3 weeks after a procedure or that involves the lower face or the lip enhancement. But in general, people should not cancel any daily routine activities or social plans or events if they have a procedure like this. The procedure is less expensive than compared to traditional surgery. I put my patients in a plan of maintenance because everybody asks me, how long does this procedure last? It lasts forever as long as you're maintaining a protocol where you do 2 or 3 enhancements per year depending on the age or the situation of each patient individualized, and addresses people of ages from 20 to their 60s or 70s. Any gender could benefit from it, like men and women. The only contraindication is that I don't recommend for women that are pregnant or women that are breastfeeding. I usually try to rule out any patients that have other medical conditions. So I do a pretty thorough screening before I recommend the procedure to my patients. How I developed it, I realized that this time we're getting more and more products, like you could see here, that are available to create this alternative approach. The products are several, and I will only mention a few. The newest is Velour. This is used for nasolabial folds. It's also used for deeper wrinkles on the face. And it lasts up to 18 months. It's the newest hyaluronic. Voluma, it's used for mid-face lift. It's also a long-lasting product. I recommend that for in combination or sometimes by itself for the mid-face lift. Sometimes I combine that with Radiesse. It's not a hyaluronic. It's a hydroxyapatite product, and it's very good in mid-face lifting, very efficient. In combination with Voluma, I had very good results. For the lips, I recommend Volbella, Juvederm, or Velour. All these products could be combined in different proportions and in different ways in order to achieve the need of each patient. Why is my approach different than others? Because I address the entire face. I customize this procedure to every individual need, and that is done with an original and initial consultation. I take time to understand my patient concern and address the signs of aging with a program that makes them look younger and natural. I also pay a lot of attention to skincare, and I always educate my patients about how important it is to go in a skincare program that will maintain the results of this injectable products with the need for maintaining good hydration, moisture, elasticity, and nourishment of the skin. And with that in mind, I developed a product that's called Blvd. This is my face and eye cream that I developed, a line of anti-aging products. This cream it's made out of organic essential oils. It has very high-end hyaluronic. It penetrates very well. When you use it, it creates this nice natural elasticity, hydration, and nourishment to the skin. It's a night cream, a day cream. It's extremely good for people that suffer from dry skin and aging skin. It's very natural around the eyes and helps a lot with people that suffer from dry eyes. And I'm doing a study right now with this eye cream, combining the use of the cream around the eye with the teardrops, and it replaces the need for using other alternatives of medications that need to be used if somebody suffers from dry eyes. Years and years of studying what makes a face beautiful and what is the new definition of good result. What do we call a good result? It's a result that's pleasing, that's not plastic, that's not overdone, that's proportionate to a face. And I usually try to educate and guide my patient in that direction. So a patient that comes and has a European fluid facelift will have some kind of a confidence that their look, it's going to be a natural look. They will look themselves, they will not have surprises, and they will actually be impressed in how natural they look. Sometimes I ask my patients to bring pictures from how they look years ago. I could make them look with this procedure. And here we have a beautiful lady in her late 40s, let's say, very well maintained, a beautiful face. She tells me that she's concerned about these two lines and the marionettes. And I looked at her and I said, look, show me your frowns, lift up your eyebrows, and do this. So I immediately noticed that she needs to address these little lines and wrinkles on her face. I would recommend a new product for her face, which is called Velour. It's used for treating the nasolabial folds and the marionette lines. Sometimes I also use it for the lips. I would put the Velour in the nasolabial folds. I would put some in the perioral area. And I would use a little bit of radiase in her cheeks to just create a nicer, natural result of my treatment. Very good. So we clean. It's always good to use alcohol and maintain a sterile technique. This is the Blt Numbing Cream. I like to use that and leave it on the face for about a few minutes before I start the treatment. So this is not a painful procedure. So I usually start by doing the Botox treatment. When I'm planning a fluid facelift, that's the first one I do. And then I'm going to talk about the amount of Botox that you need for each part of the face. Many times I combine radiase with Voluma for even more enhancement of the mid-face. These are deep treatments. We have to go deep on the bone, on the periosteum, and that creates the mid-face lift, sometimes better than the surgical improvement. But it has to be diluted, so I dilute this with lidocaine. So what we do, we call live injections. So now we accomplish the consistency. We're going to start with the Botox. There are two muscles when we inject the 11 lines. Is the corrugator and the procerus muscle. The corrugator has this one, and the procerus is the one vertical. And unless you treat both, the 11 lines are still going to be present. Now, the lateral aspect of the eyebrow has to be higher than the middle. That creates a nice, desirable position of the eyebrow. So this is Velour for nasolabial fold and for marionette lines. It goes not as deep as Voluma, it goes more into the dermis. For her lips, I'm going to use Volbella. Volbella, it's injected into the vermilion border, which is the edge of the lip, and it creates that nice definition of a lip. This is a perfect lip result. Why? It has the shape of a diamond. The two pubis bows are well defined and discrete. The upper lip, it's 2/3 of the size of the lower lip. The upper lip has a point. It has the two lobes, and the edge of the lip it's higher, and like the end of the lip it's higher than the middle. So it's a nice, happy looking lip. The bottom lip has two lobes and the proper volume. And with that being said, I think she looks amazing. Let's see what Blvd does to your face. We're also offering PRP. What's PRP? We're injecting plasma in the scalp, and also patient's own plasma in the scalp, and sometimes even different facial skin areas for skin rejuvenation and for hair growth. This is done by collecting someone's blood, centrifuging and separating the red cells from the plasma, and the plasma that's rich in growth factor stimulates regeneration of skin and hair production, new hair follicles. And this is one of the newest and best treatments for hair loss. In summary, the European fluid facelift is a great alternative to traditional surgery. It has less downtime. It's cost-wise, it's much less than traditional surgery. The results are natural, immediate, and if you want to look younger and discover your fountain of youth, think no more and visit us at MedifaceSpa and my office. Our team is highly trained and skilled to address the signs of facial aging, and I'm sure you'll be happy to at least come for a free consultation and hear more about this wonderful procedure.
With this program, we continue the meeting with board-certified ophthalmologist Dr. Alina Kochoumian Stanciu. In our last episode, Dr. Stanciu introduces her aesthetic center. In this second installment, she describes her work in advanced eye care. With over 18 years of experience, Dr. Stanciu discusses numerous eye illnesses and their medical and surgical treatments.
I want to show my patients, and this is what I do when I do an eye consultation and I have to describe a condition of the eye. I use the model eye, and this is a giant eye that I have the ability to open up, and I'm going to go one by one the parts of the eye. This is called the cornea, which is the front of the eye. This is the lens, which becomes the cataract when it gets cloudy. This is the retina, which, as you could tell, has a lot of vessels. Retina, which is the back part of the eye, is the only part of the eye that cannot be replaced. And the center of the retina is called the macula or the fovea. These vessels are an extension of the vessels that are in our body. So if we have high blood pressure, diabetes, or any other conditions that affect vascular circulation, we see it first in the eye because we have the ability to look in the eye and see these vessels directly. This is the optic nerve. This is where all the bundles of nerves take the image from the eye, from the retina to the brain, and that's how we connect with the world. Diabetes is a very prominent condition. A lot of people suffer from diabetes. There are newest approaches to how we treat diabetes in the eye. We don't do lasers anymore so much. Actually, I do laser less than 10% of what I used to do years ago. Now we have injectable intravitreal injections that are used in treating bleeding in the eye, and they're quite efficient. Patients with macular degeneration, there are a lot of advances now in treating and addressing macular degeneration. I've been treating this condition, which is the leading cause of blindness in people over 60, I would say. There are new techniques and new ways of treating this, but again, prevention is very important. Glaucoma, it's another specialty that I have a great interest in treating experience over the years. And there are two kinds of glaucoma, narrow angle and closed angle. What's new in treating glaucoma? What's new is that, again, the same principle applies here. Early detection is key. You don't want to wait until you have advanced glaucoma to discover you have glaucoma. And how do we detect it? By doing a thorough examination. In my office, we have 3 steps that we do. One is we check the pressure, we do a visual field, and then we have the advanced OCT machine, the Heidelberg, which is very sensitive to early changes of damage to the optic nerve. Glaucoma, it's pressure in the eye that affects the health of the nerve. And when the nerve doesn't work well, then you start getting blind spots and losing sight. So the whole key is to prevent this damage to happen, because if it's detected early and the pressure is checked periodically and is maintained at a level that's safe, and I consider most of the time the safe level to be less than 14. In the past, we used to think, oh, the pressure is 20, up to 21 is normal, don't worry, you don't have glaucoma. That is not true. Every patient is individualized. You have to treat glaucoma individualized for each patient. Some people with a pressure of maybe 15, 16, they could lose eyesight if they have bad circulation. Other patients come with pressures that are like 20, 24. They have no idea they had pressure, because glaucoma, it's a silent disease. You don't know about it until it's too late. This is early stages of glaucoma, but that's the whole idea. You want to detect glaucoma early. Diabetics, people with high blood pressure should have their eyes checked more often. Make sure they don't develop glaucoma, because both diabetes, high blood pressure are risk factors for glaucoma. This is how we treat glaucoma. Initially, we start with drops, combination of drops, and then we monitor that pressure. But if that pressure still is up and the patient sometimes can't afford to pay for all these drops, the other alternative is to combine drops with laser. So we do in this office the newest and the latest laser for glaucoma. And in even more rarer situation, when it's a very bad case of glaucoma, surgical approach is also indicated. So glaucoma has 3 levels of treatment: drops, laser, and if that doesn't work, then we recommend a surgical approach. So this is a patient that comes in. We just discussed what the cataract does to the eye. It creates like a film over the eye. As you could tell, this picture looks like it's not focused. Why it's not focused? Because it's the cataract that's making the film over the eye, and we cannot focus very well on the retina. So this is a patient that has a dense cataract, a small hemorrhage in the eye from diabetes, and we check the circulation in the eye, we check the health of the eye. We get a lot of information just by using this wonderful machine, which is called the Heidelberg fluorescein angiography OCT machine. A patient that has a cataract is going to need to understand what a cataract does. It's like a film over the eye that creates a fog, creates glare, and creates poor vision in dim lights or at night, driving at night. All these things affect the ability of a person to function normally. That is the patient complaint. But then my examination will reveal the presence of this cataract. Then I would sit down and discuss with the patient, how do we address this cataract? The treatment for cataract is usually surgery. So we need to make a plan for surgery, which is not a very complicated procedure, but it has to be done in a way where it's a smooth event. If somebody wants to see after cataract surgery and doesn't want to wear glasses, then I offer the newest and the best, which is the multifocal, which we call it like the zoom lens, that corrects the vision, and you don't need to wear glasses for 80% of your activities. But not everybody it's a candidate for this procedure. Some people who have eye problems like glaucoma, corneal disease, retinal disease, which I carefully check before I offer the options to the patient, sometimes they cannot have all these options, so they have to use the regular lens. My lens of choice is usually the AMO Technique lens. It's a very good lens. It gives very predictable visual outcomes after cataract surgery, and does not require stitches, does not require anesthesia, and the procedure, as I said, takes about 10 minutes. The other procedure that I offer to my patients, if they absolutely want to have the laser-assisted cataract surgery, that's the newest approach to cataract surgery, and part of the surgery is done with the laser. Everybody says, why did you go into ophthalmology? And I say, because I find the eye to be the most fascinating part of our body. Not only that is a very complex organ, it has a lot of delicate structures that have to be very carefully evaluated and diagnosed with very subtle signs, and that I love to find things and treat those things. I recommend everybody over the age of 40 to definitely have an eye exam once a year. Diabetics should have their eyes checked once a year if they are well controlled, and if there are any issues, twice a year. Patients with macular degeneration, which is the leading cause of blindness, and I specialize in treating macular degeneration, should definitely be screened early, because early detection will prevent lots of problems and prevent vision loss. So we have a whole range of technology that allows us to do a very thorough and up-to-date and advanced, efficient and professional and complete evaluation of our patients. Preventing vision loss, it's one of the things that I dedicate my profession, and I feel very strongly to help my patients understand what to do to maintain a good vision and to treat their conditions with the newest and the latest technologies in addressing certain conditions that I specialize in.
The Advanced Eye Care Clinic of Armenian ophthalmologist Dr. Alina Kochoumian Stanciu is happy to take care of all your eye and vision medical needs. To make an appointment, please use the contact information on your screen.